Yeah. Okay, brilliant. Yeah. So welcome, everybody. My name is Sonya Foley, and I work for Aneurin Bevin University Health Board. So I work as a program manager, working on the delivery, the implementation and the delivery of the dementia standards across Gwent. And so what that means is that's all about improving dementia care and support, every aspect of it, from diagnosis right through to end of life, improving the experience for people and for their families. So it's all aspect of dementia. And part of this work then, what we've identified is there is a need for people to understand or to explain to people about brain health, lots of people have heard of dementia and they know what it is. So I'll just give you some key messages before I move on to the other bit. So dementia is caused by diseases of the brain. It's not mental illness. People often get confused there. It's not a natural part of aging. So lots of people will get older and will age, as we all will. That does not mean that we'll get a type of dementia. However, as we get older, that in itself is a risk factor for dementia. Dementia being an umbrella term, and it is a condition with, and there are different types. So when I say dementia, there are lots of different types, and how it impacts people is very, very varied. Now, one of the things we do know, however, is we know that there are 12. What we don't have is a cure for dementia, I should say. So we don't have a cure. There's lots of research going on to support us to respond better, to look at treatment options, to slow down the progression, but we don't have a cure. However, what we do know is that we know there are 12 risk factors for dementia, and we'll share that poster with you later. And so what we know is these 12 risk factors that some dementias, some types of dementias, we may be able to prevent these dementias if through our kind of lifestyle and looking at the risk factors. So let me just go through them with you. Okay, so one is, and lots of the risk factors for dementia are similar for risk factors for other diseases. So it's worth kind of bearing that in mind, and some of them you probably won't be surprised to hear about either. And we kind of map this, we call this about brain health. We talk about how do we look after our brain, and lots of these support kind of good brain health. So physical inactivity. So that means when we don't move, we know our bodies are designed to move, we need to move. And when I say we need to move, it's not about, every little thing. These are very individual things as well. So there's not a kind of a set program of what you need to do. It will be about, what works for you and what's best for you. We know sometimes people, they do chair-based exercise, for example, if they can't walk. So there is lots of ways and lots of adaptations that can be made to suit an individual need. But moving your body is really, really important. Number 2, smoking. Again, we know that this is a high risk factor for dementia, but also this is a high risk factor for kind of cardiovascular, so heart disease and things like that. Excessive alcohol consumption, so that's drinking a lot. We also know that people seen an increase in liver disease as well, where alcohol is an issue for that. So excessive alcohol consumption. So again, asking people to think about the alcohol they consume and what changes they could make in that instance. Air pollution is a risk factor. So, we know that lots of local authorities and our government, they're working on a kind of environment and how we can have a kind of a cleaner environment, and looking at lots of different sustainable measures and things like that. Is that my noise? Can you hear a noise, Esther?
I can hear some background noise, but I think it's from you. Everybody else seems to be on mute. Sorry.
That's really strange. It just kind of came through the computer, but I don't know where it came from. It's really strange. Okay. Okay, let me see. Where was I? Yeah, I don't know what happened there. Okay, so where were we? We were talking about alcohol consumption or air pollution, sorry. Infrequent social contact is another risk factor. So, and some people, I spoke to someone recently and they said that isolation and people not meeting was a huge thing, and they saw people really struggled with this during COVID. But it's really important for us to have those social contacts, to meet people, having that engagement, and just being mindful if there are people in our families or people we know of, if we have any concerns, to think about that. Again, a very individual thing. There's not one size fits all. Thinking about works for you, but that interaction, engaging, communicating with people really helps. Obesity is another one. And again, this is a risk factor for heart disease. So looking at any changes we can make to the food that we eat, thinking about reducing our processed foods, takeaways, things like that, thinking of, again, changes that we can make. I mean, the diet and nutrition, when they talk about brain health, they recommend the Mediterranean Plus, and the plus being the seeds and berries and nuts. But again, it's not about, it's small changes, any small changes we can make, and what can we all do? Looking at the kind of maybe the level of fats and things in our diet, the saturated fats, could you make changes there? Could we just swap some of our foods? Could we think about, changes or and all of that? And with all of these risk factors, there is support and help both locally and nationally for people to get that kind of one-to-one or tailored support. Hearing impairment is another risk factor. When you think about it, if somebody can't hear, then it's very difficult for them to engage in the conversation. So maybe they stop engaging, they stop withdrawing, or they start to withdraw, and they have that lack of engagement and interaction. And again, these are things that can be easily sorted by going to see somebody, an audiologist, if you've got any concerns about hearing. Depression is a risk factor. So this is our mental health and our mental well-being, and thinking about that. And again, reaching out for support through organisations, through your GP, if you've any concerns about your mental health, or if you've any concerns about someone in your family and you're seeing any signs of depression or people are becoming withdrawn. Diabetes is a risk factor. So again, for people who maybe have diabetes, that making sure that that's managed, whether it's through diet or medication, or if you have any concerns, making sure that you get these things checked, easily checked, to see if you have diabetes. Hypertension, so that high blood pressure. Again, the message with brain health is what's good for the heart is good for the head. So we're thinking about our healthy heart. We're thinking about all the things that can help that. So if you have, or making sure that you have these checks, similarly with diabetes, check in to see if you've got high blood pressure and how that can be managed and what's needed. Less education is a risk factor. So sometimes it has been identified that maybe people who haven't gone through levels of education, maybe they've had difficulty accessing it. So thinking about how maybe you could learn something. This does not have to be about going to university or sitting exams. This could be a skill, a hobby. So thinking about anything that we can do to stimulate our brains. This is really good for our brains. In the same way we need to move our bodies, we also need to keep our brain really active, whether that's socializing in groups, learning, doing a quiz, doing a crossword, anything that does that, learning a new language. There's a lot of research to suggest people who speak more than one language do really well. So that's something for people to consider. But again, very person-centered. So what works for you and suits you and your ability. Head injury is another one. So we know, we've seen research where people maybe have had a head injury or concussions. We know that that's been taken very seriously now in the sporting world, where people are thinking about precautions, whether it's rugby or whether it's football, and thinking about how they can keep people safe and make people aware. So that all of that's happening. So they're your 12 risk factors for dementia. Did you want to say anything, Esther? Sorry. No. They're your 12 risk factors that we're looking at for dementia. And I just want to speak just a little bit about some of that. So the thing about exercise, what exercise does is it ensures a good blood and oxygen supply to the brain, and improves mental well-being at sleep. So they say to aim for at least 2 to 3 hours of moderate intensity exercise every week, so enough to break a sweat. So that's really important when we're talking about exercise. There are national exercise referral schemes, and you can be referred to them through your GP, or you could have a look with your local authority if they've got any kind of exercise groups on or courses that may be of benefit to you. We know most areas have got a leisure centre and they've got classes that work there. Something that's also recommended is Tai Chi. Tai Chi is a Chinese martial art form consisting of sequences of very slow, controlled movements, and studies have shown that that can improve cognitive function, so your brain and your thinking, activities of everyday living, and it has a moderate reduction in falls, so people having a fall, in depression, in stress, and dementia risk in people with mild cognitive impairment. Mild cognitive impairment is something that we see people, they may have, so it's not a dementia. However, it may go on to become a type of dementia, but sometimes people, through these lifestyle changes that we're talking about and this brain health, that they can change the trajectory. So again, Tai Chi might be available through the National Exercise Scheme. Diet, so we've already talked about the Mediterranean style, so eating more vegetables, fruit, beans, fish, whole grains, olive oil, so eating less meat, sugary and processed foods. Again, that message, good for your heart, good for your brain. So they talk about lipid lowering foods, so again, watching that kind of saturated stuff. And I should say to that, what we're talking about here is also knowing your cholesterol levels. If you've got we've good and bad cholesterol, and if you've got high cholesterol, and sometimes that can be genetic or it can be diet related. But again, having that knowledge, so do you know your blood pressure, your cholesterol, your risk of diabetes, your weight, your BMI, which sometimes people argue that the BMI isn't always helpful, but just understanding your kind of risks there, or if you need to look at that and get support. So in terms of challenging your brain, learning and socializing stimulates new connections between nerve cells. So you can actually change the physical structure of your brain. So by taking courses, reading, as I've said, learning a new language, doing arts and crafts. So the research shows us there are strong social ties that stimulate the brain. It can lower blood pressure and increase life expectancy. So, for example, stay connected with friends and family, join a group, volunteer. We've loads of volunteering opportunities in the health board, but they also will have in other organisations. Develop a strong social network and have fun. You could look at adult education in your area, courses, and again, a lot of these may be free or affordable or subsidised, so that shouldn't be a barrier. We know that smoking damages the blood vessels that supply oxygen to the brain. So by stopping smoking, it can increase your brain health. And again, there's lots of free helpline numbers to quit smoking. You can speak to your GP, your pharmacist, and the NHS has a service, Help Me Quit. We've spoken about alcohol, but just to say that exceeding the recommended weekly limits for it can damage the brain. It's a major risk factor for dementia. So at the moment, it's recommended not to drink more than 14 units of alcohol per week. 14 units is about 6 pints medium strength base lager or cider. It's about 7 double measures of spirits. It's about 6 medium glasses of wine. Again, there are up numbers for Drinkline. You can call for free. You can speak to your GP, find a local support group, look at alcohol support. So we've talked about the brain injuries, but there's things we can do, again, to minimize risks. So always wear a seatbelt when we're driving, minimize our risk of falls, wear a helmet when cycling or playing contact sports. And you can look up Prevent Traumatic Brain Injury and NHS Falls Prevention. So there's stuff on our internet and there in the, if you Google, to have a look and make sure that we look to protect ourselves from that. So we know that mental health, long-term stress can be harmful to the brain. So take time for yourself and find out strategies or what works for you to manage your stress. Depression and anxiety, it reduces the ability to think, concentrate and make decisions. So look into the benefits of mindfulness apps, counselling, reading well. We know that mindfulness is really, really good. That's just that slowing down, getting us to be present and in the moment. And that really works well for the brain. Sleep is always also very important for your brain health and memory. So your brain cleans itself during sleep, flushing out the waste products of the day. So storing new memories and learning. So aim for about 7 to 9 hours of quality sleep. And again, there's lots of help out there that people can look at: mindfulness apps, reading well, sleep hygiene, if you've got any concerns. There's a strong link, we've said already, between hearing loss and dementia. If you've any problems, speak to your GP. We spoke then about the high blood pressure, diabetes and high cholesterol. We've said there are no current medications to cure, slow down or reverse dementia. There may be memory medications that can be prescribed at the right time, and they can sometimes on a temporary basis help with memory and thinking. Memory medications are not as effective in people who have vascular dementia, so they may find lifestyle changes help them. So even though somebody may have a dementia diagnosis, these lifestyle factors that I'm speaking about can also help them in their dementia. They've suggested then that to people to go to your GP to change one medication for another. This is to reduce the risk of dementia. So this is kind of in the mild cognitive impairment clinic, they were giving some of these people this advice, the anticholinergic drugs. This is to reduce, so they might be amitriptyline or some antihistamines. So they were just looking at some of the medications that people maybe take. But again, speak to your GP about any medication or anything you're concerned about, or if you're concerned about your memory, or you see any signs and symptoms. So this is not something you would do via Google. Always seek medical advice. But the lifestyle changes, these are something that you can do. You can do now. Again, you can speak to a GP, or you can contact, local authorities, or you can get involved, or, if you want to contact me again. These are some of the lifestyle factors that, and again, a lot of research is going into this. I see the Alzheimer's Society they've got a brain health questionnaire now. They've got apps in brain health, and you can answer some of the questions. I'll see if I can find a link and send that out, and you can see where you are with your brain health. And similarly, we'll ask you about a lot of those lifestyles that I've mentioned, about the amount of exercise, your diet, your sleep, your alcohol, smoking. It will kind of ask you those questions to see where you are in terms of your brain health. But all of these, sometimes people get really worried, and it's even making small changes can make a difference. All these little changes can reduce our risks. So we would encourage people to kind of think about it, think about all the things we can do to stimulate and help our brains and our bodies. And if you have any concerns, then to seek help if you're concerned. I have had the menopause nurse that works in the health board. She said that sometimes women have reached out to her thinking that they are having early signs of dementia, but it's not. So I've shared the risk factors. So sometimes some of the symptoms with the menopause, maybe the brain fog, or they're feeling, so they felt quite worried. But again, she's gone around and trying to give people information about lifestyle and how that can help them with the menopause. So lots of the conversations will come back to those lifestyle factors. What can we do to improve our health and well-being, and kind of see it as a whole. Any questions or comments or anything at this point? No.
Julie, do you have anything? Yeah.
Yeah. When you said about the exercise group with the leisure centre, is that nurse?
Say that again. The exercise with the leisure centre?
Yeah. Is it called nurse, National Exercise Referral System?
Oh yes, they do have that there. Yes.
And can you put your name forward for that yourself, or is it got to be done by a nurse or a doctor?
I'm not too sure. I thought you could put yourself forward with NERS, the national. Oh, maybe it's through the GP. I can check.
It used to be a doctor or a nurse, but
Yeah,
I'm sure I heard somewhere that you can refer yourself.
I'll check. I know. Yes, it used to be through the GP, but I'll check if you can refer yourself.
Okay, thank you.
Yeah, no worries. I can check that for you. But yes, that's it. And they can tailor as well, tailor the exercise to your individual needs. As I've already said, you know, we have people doing chair-based exercise, and there's a lot of evidence and research to show that that's really effective as well, and strengthen our bodies. And all of this as well to preventing falls, all of these things that can help our bodies and strengthen our our muscles and strengthen our bodies and our core. A lot of people do yoga. I met a lady the other day in a care home. She has dementia. She's in her 90s. You wouldn't know. Her skin looks like she's in her 70s. She did yoga her whole life. And she just looks incredible. And she's first language Welsh, and she goes to Welsh classes every day, even now in her 90s. So she speaks Welsh. So, you know, you can see people who've, you know, and that can help her.
Mandy, I think your background noise is quite high.
So yes, you know, there's no age limit for any of this. You know, there's absolutely not, you know, from very young, as long as, you know, we have breath in our body, we say this. So sometimes people think, oh, that's for that age. There's not, you know, age is it's a number, it's chronological. And, you know, so everyone can do all of these things. It's never too late to do any of these things to kind of support our mental health, our well-being and our bodies. Yeah. Any other questions?
No, I think that sounds great. Thank you, Sonia, for putting it all together. So what I gather from you is that lifestyle modification is the key message. Healthy heart, healthy brain, as you said. And also you mentioned about, doing some regular exercises, Tai Chi, yoga, and mindfulness that can play a big role. And I think, breathing exercises do play a big role as well, because when we are doing the deep breathing exercises, we are using more oxygen, and oxygen is then going to each and every cell of the body, including brain. So regular breathing exercises can be helpful too for the mindfulness, for, to reduce the risk for dementia. But yes, no, I really enjoyed the talk, and the way you put it together, that was very useful. Yeah. So just to emphasize that through Thriving Communities, we also do Mind and Body Wellness Program. And Mind and Body Wellness Program is a 5-weekly program. On this program, we emphasize more on diet, sleep, exercise, mindfulness, and yoga also plays a role. And I think what you were mentioning, so in this session we do that as a practical in the Mind and Body Wellness Program, so everyone is welcome to join on that. But no, it was very useful talk. Loved it. Thank you.
You're very welcome. You're very welcome. And remember, small changes, and we can all, it's for everybody.
Yes.
Yeah.
And I loved the idea you mentioned about volunteering.
Yes.
Yeah. And then keeping yourself, more socially active is so important.
Yes.
And we had a last session we had about volunteering, that you can volunteer with the community. So that's very useful. Thank you for putting it together. Yeah.
Yes, yeah, you're very welcome. And if anyone wants to get involved in any volunteering options in the Health Board, Esther, you can give them my email. We have end of life champions, so people who support people at end of life. With lots of, or they get involved in the community. There's lots, but there's even your local authorities, your schools. People are always looking for volunteers, and again, that really can support people's well-being and their brain activity. Yeah.
Oh, that's very useful to know. Yeah. Lovely.
I just want to make one other mention, something you haven't yet covered, but it's, you know, what was revelatory to me was, you know, how dealing with people with dementia, because, you know, that bookcase
Yes.
analogy, I found that really helpful, because I wish I'd known all that information when my mother-in-law was over here from Greece and she had Alzheimer's. And you know, we got impatient and frustrated with her, and we were doing all the wrong things, you know. But if I'd known what I know now, it could have been so much better experience for her and for us, obviously. Yeah. So I don't know whether you want to mention that. I think you're frozen.
Yes. Yeah,
Sonya?
that's very, yeah, that's very useful. I don't know if my
Sonya, you mentioned obviously the risk factor and preventable risk factor. What is the role of a genetic factor, obviously, which we can't prevent?
Yeah, can you still hear me, Esther?
Yes, we can hear you, but yeah,
your camera's off.
can't
Yeah.
see you.
Yes, the internet was going. Did you want me to explain about the bookshelf? Did you?
No, I think there was another question after that about the role of genetic factor.
So let's go back to the risk and the genetic factor, and then you can come back to the bookcase scenario.
Yeah. Okay. We don't know enough yet about the kind of genetic. That's not as high. Sometimes, though, what can be is other diseases can be. Sometimes you can have other genetic diseases which could then be risk factors. So it's not the dementia, but there are kind of maybe other things around vascular or other things. But no, it does. Just because someone in your family has had dementia doesn't mean that you're going to have it, a type of dementia. No. But the other risk factors you might find that in your family. So, for example, sometimes with cholesterol, there can be genetic links there. So again, it's knowing our numbers. It's knowing our numbers, and our health is really important, and knowing about our individual bodies and risks to be able to manage is important. Yes.
I have found the image of the 12 risk factors. I don't know whether you want me to share, but it's not a very low resolution image.
Yeah.
Don't want me to try and share it, or we just?
Yeah. No, don't worry. It's probably too low yet to share it. But in terms of the bookcase, so when we have people with dementia in our lives and in our families, sometimes people, they think, okay, the person didn't remember me or didn't remember that I visited, you know, and they kind of think, well, what's the point? And actually, if you think of a bookcase and you think of the brain, so at one side of the brain, so the hippocampus, that part of the brain that stores the memories and all of that, if you think of that, it's made up of really kind of not very solid wood. So as the disease impacts on our brain, you've got books on that bookshelf and it's not very strong and it's getting rocked. And so what happens then is the books at the top of the shelf, of the bookshelf, they're going to go first. And so that's our kind of short-term memory, you know, where you went today, who you spoke to, what happened. So those books are getting moved in the bookcase because that bookshelf is made of MDF. It's not very strong. And so what you're left with then in that bookcase is the books further down that bookcase, which represent our memories. So when you got married, when you had children, when you went to university, so you're going all the way down to when you were a child. Those are the memories that are kind of still on that bookshelf, okay? So you might find the person doesn't remember you visited, doesn't remember that you went and had a lovely outing, went out yesterday and had a lovely time, but they will maybe make reference to their children, maybe make reference to needing to collect their children, or, you know, because they're in their memory, that's where they are, they're at a different age. Okay. So the other bookcase, the amygdala, is that part of the brain that stores the emotions, is made of stronger wood. It's much, much stronger. So even though the disease is impacting the brain, the books aren't falling out in the same way on that side. Okay. So the example then is you spent some time with your family member, your loved one, your mom, your dad, in-laws, husband, wife, and they haven't remembered the visit because that part of the brain has just been impacted in a different way on that bookshelf. But what they will remember, if that visit is, if you had a very, very nice time, if you've really been, it's been quite warm and you've enjoyed it, they're left with the feeling. So they can't say to you, oh, thank you for coming yesterday, or I remember that we went for afternoon tea or had an ice cream. They can't, but they're left with the feeling. And the reason that's important is if when you went and spent some time with someone, you were irritated with them, you were irritated or annoyed, or you were just stressed, they won't remember what happened, but that you're leaving them with the feeling. And so this is why we say all that contact you have with everyone as their dementia progresses is really important. And it's really important to use that time. Your facial expression is really important, because they won't be able to ask you what's wrong. You know, they won't be able to have that the discussion that requires lots of cognition. So that's why that's really important. So just, people often think, oh, they didn't remember me, but that's because that bookcase has been impacted. But the feeling and emotional side of their brain is going to last a lot longer as the dementia progresses. So we encourage people to do that. And that's why when you work, so people working in care homes and hospitals, that interaction, you know, never coming from behind, never startling anyone, looking at your facial expression. They do a lot of hand-on-hand as well. We talk about hand-on-hand care. All of that can make a real difference in helping someone to feel orientated, secure, and reduce their level of confusion.
Thank you so much, Sonia. Has anybody got any further questions? I think that was really, really helpful. And for me, really, it was a light bulb moment having that bookcase and that analogy provided. Yeah.
And the other thing I will say as well, I've said these risk factors, that, you know, this lifestyle and how people live is very important for people with dementia. And I will again remind people that hydration and nutrition is vital for people with dementia. You know, as somebody said recently, if you haven't seen a UTI until you've seen someone with a dementia and a UTI, and we know that we can do things to prevent that. And if somebody isn't drinking water, sometimes we need to rethink the color of the cups and the color of the plates and things that it's been presented, because sometimes it can be a visual thing. If it's white is a very difficult color for people with dementia. So we might change the color of the cup to put the fluids and drinks, or also you can get jellies, hydration jellies. So there's lots can be done. So never just think, oh, they're not thirsty or they're not hungry. Nutrition is really important for people with dementia. And by making sure that they remain hydrated and safe, we reduce the risk of falls, we reduce the risk of going into hospitals. We always want to avoid anyone with dementia going into our hospitals, particularly through ambulance and A&Es, and we do not want them staying in our hospitals, because our hospitals do great work and they want to do better, but they're not the place for people with dementia to be for any length of time. So those little things, you know, looking after people with dementia is equally important as for ourselves.
Excellent. Thank you for covering that point. That really helps. And before we conclude, anybody has any final words or any more questions? Whilst we've got our expert here.
It was quite informative. Thank you.
Yes, yeah, there was a lot crammed into that, wasn't it? Yeah. So what I'll do is obviously if you're interested, if you're not on our mailing list, make sure that you are, and you can send that to me on Facebook Messenger, or you can go on our website and contact me through that contact form. So our website is thrivingcommunitiescic.org. And what I'll do is I'm going to send out anyway an email with the link to the recording when it's uploaded, and also with the reference, so the link to the questionnaire that Sonya mentioned, and obviously hopefully an answer to that question about nurse. Yeah. Mm-hmm. So, and anything else that Sonya might think is useful. Yeah. When she thinks about it. Yeah. So I'll collate all that. Yes, Julie? You had your hand up.
It's not to do with this, but it's to do with the thriving communities, with the events. How many events have you got planned for Bryn and Gwent?
That's coming up. So we've only just been notified that we've had funding to roll out more events in the Blaen and Gwent area, which will incorporate the Mind and Body Wellness Programme. So we're in negotiation now with Bevin Institute as a starting place to roll out some of those events. We're just waiting for the lady to come back on holiday because I need to view a different room. The hall is taken. So, and then we've also got funding to do some concerts, some Nordic walks, which we, you know, Sonya has mentioned exercise, and that's a brilliant form of exercise because it's sociable, it's fun, it's a full body workout, it helps improve metabolism, it helps improve sleep, and, you know, the cardiovascular health is important, and also it helps with the brain health. So just, you know, and avail yourself of these opportunities because the funding makes it, will actually make it free as a free taster. We have a couple of free tasters. So just as a springboard to take you into maybe something that's more permanent, and we continue with more sessions later on in the year, maybe into next year. So yeah, this funding allows us to roll out all these things coming now from September onwards.
That's great. I'm glad to hear that.
Yeah, I thought you might be, Julie, because you're moaning that it's all Caerphilly based, and I said no, it's Blaen y Gwent, and also we've got some more other funding to do some stuff in Newport. So if anybody knows of anybody in Newport, so yeah, send them our way and
link in with me because we're working across Gwent, and I've very good links in Newport, very good links with the age-friendly communities lead. So each local authority area has age-friendly community lead because all local authorities are going for this accreditation to become an age-friendly community. And this is really vital because we are looking at this aging well and looking after ourselves. So that's a very key message. And in Newport, we have links with our ethnic minority groups, and we do a lot of work. They've picked 3 topics. They've picked diabetes, menopause, and dementia, one of our links. And we have translators where there's lots of different languages. So we are doing a lot of work there because some of our groups and the Muslim Doctors Cymru have been doing great work around screening and bringing those health messages because some of our particular communities, their risk factors, you know, they may be predisposed to certain diseases or risk factors. So I have got really good links in Newport. So if you need anything, do link back to me then as well.
Great, that's good to know, isn't it?
Yeah, I think thank you, Sonia, for offering that, because we are looking for starting our next Mind and Body Wellness program from September onwards in Newport. We have got some dates finalized. It's just now, you know, we are just finalizing the venue. So yeah, it would be great, you know, if we can get in touch separately.
Yes.
Session.
Yeah. And if we can help with venues or wherever, we have people happy to help there. We know some great places, and
Thank you so much. Much appreciated.
Excellent. Thank you so much. Appreciate you taking your valuable time to share this wonderful information. You've always been such a great support to us in the Mind and Body Wellness program. And have a lovely day. Enjoy that weather, everyone.
Lovely. Take care, everyone.
Yeah. Thank you.
Bye, everyone. Have a lovely day.
Thank you very much.
I don't know whether you want to make me host again when you go back, or whether I just leave and you'll have to end the call, Sonia.
Okay. Yeah. Okay.
Yeah. Should I just leave, or should I wait till you make me host?
Oh, can I make? How can I make? Can I just end here?
You can just you can just end it and end the call. I should have the recording. Thank you so much.
Thank you. Thanks.
Bye,
Bye.
everyone.
Bye.
Bye.
Bye.